My name is Dr. Angela Chaudhari, and I'm the Chief of Gynecology and Gynecologic Surgery at Northwestern University. I began as a MIG surgeon during my fellowship back in 2004 in Celebration, Florida. I've had the opportunity to work all over the country at many universities, Drexel University, the University of Utah, and now here at Northwestern University as a minimally invasive gynecologic surgeon. I practice a full range of minimally invasive procedures, including laparoscopic hysterectomies, myomectomies, as well as, of course, hysteroscopic procedures such as hysteroscopic myomectomies, septum repairs, and adhesion takedowns. I use the Resectoscope for almost 100% of my fibroid removals. The reason I think that that is so important is because with the Resectoscope, with the bipolar loop in particular, I have the opportunity to really shave down the fibroid, get deeper into the wall to really get a full resection of my fibroid. Now, why is that important? You know, removing fibroids completely is really what gives patients the best symptom control, both from a bleeding perspective and probably even more importantly in our fertility population. So patients who are looking to get pregnant, we know that fibroids left in the cavity can actually be a nidus for an area of abnormal implantation and can lead to future miscarriage. And so it's very, very important to me, especially in my fertility subpopulation, that I remove the entirety of that fibroid in order to get them their best reproductive outcomes. In the current marketplace of gynecologic surgery, there are so many general gynecologists performing hysteroscopy every day. I think that the morcellator is a very good tool in the hands of many of our generalist colleagues, specifically for things like polyps in the cavity, because those are often things that they can do in their office. When we talk about more significant pathology, such as uterine fibroids and septums, and sometimes even adhesions, sometimes we find that the morcellator is just not enough, right? It's not enough to get the pathology out of the wall of the uterus. And this is why I think resection is so important. Now, of course, not everyone feels comfortable using a resectoscope. It is a learned skill that requires a lot of practice. But I do think that if more and more people were trained to use that resectoscope, we would be able to really tackle a lot of this more complex pathology within the wall of the uterus that we currently are looking for other methods to treat, but maybe not using our gold standard method, which is truly resection. I actually was first exposed to the Princess Resectoscope as part of a trial at my institution. We were actually trying out a number of different resectoscopes on the market, and we really chose Wolf because we found that it had, we really found the best resection capabilities with it. Our visualization was best, our ability to see within the cavity without significant plume or bubbles as we were using the device, and we were able to get good and deep resection. And that's really why we chose Wolf as our preferred resection method at Northwestern. What I really love about the Princess is that it is very ergonomic. I'm able to use the scope in a dynamic fashion in order to resect very large fibroids that sometimes take up an entire wall of the uterus, 4 to 5 centimeter myomas that we're resecting in this way. And what I really love about the Wolf is that I'm able to do that and maintain my visualization throughout very easily. There is an ease to putting together the Wolf that I think is so much better than some of the other resectoscopes. There's less small pieces, and our scrub team really appreciates that as they're putting together the resectoscope, because we don't feel as though we need to continue to teach them again and again and again with all those small pieces. So for experienced hysteroscopic resection surgeons out there, I really think that the Wolf, that if you try out the Wolf, you'll find that it's superior in terms of ergonomics, efficiency, ease for your OR staff, as well as your ability to really visualize the anatomy throughout the course of the case. For those of you who are more inexperienced, currently maybe using hysteroscopic morcellators and not as comfortable, I think the Wolf is the perfect device to begin to increase your experience and training in, because again, with the ergonomic movements during the course of the case, as well as your ability to see throughout, I think you will find that it is far superior in terms of removing all the anatomy, all the abnormal anatomy that you see within the cavity.
Richard Wolf, Spirit of Excellence.